audio okay? Okay, is okay? Is the audio okay now, everyone? Yeah, so I think the audio is okay, fine. So the okay and fine audio is okay, everyone? Okay, good. So yes, okay, and then we are coming over the MCQ. Yes, ma'am, now okay, thank you so much. Okay, so yes, actually I was just going through the brief of the Unacademy platform and my upcoming sessions. मैम आप ख़त्म कर देंगी मैम जी भी okay, okay, so sorry, I was like okay, just now I just I thought that you were not there. So is it okay now the MCQs have just started, so don't worry about anything, has not been disturbed, everything is fine. Okay, so let's start with the session now. So yes, I am waiting for the answers, everyone, just give the answers for these MCQs. So yes, question number 1, Vikas Datta. Okay, I got Sam is telling it's C. Sam is telling it's C. The MCQ session, Sam is telling it's the answer is C. Okay. What about others? What about others? So I will wait for others and then I can yeah, everyone is telling it's okay. Okay, the answer is which structures passes through a gap between superior constrictor and the skull. So Kumaran is telling A. Okay, so C and A. I got the answer C and A. Okay, I am getting mixed bundle of answers C and A. Okay, C and A both are coming up the answers. So yes, Shweta is also telling A. Actually the correct answer is okay, A. So A, C, okay. So A and C is the answer. So what is the correct answer? So yeah, I got Acharya telling B as the correct answer. B as the correct answer. Which structures passes through the gap between superior constrictor and the skull? Okay, so yeah. Yes. So Acharya, you are absolutely right. The correct answer is B, ascending palatine artery. So Acharya is absolutely right. Sarans Acharya, you have given the right answer. The right answer is B. Okay, the right answer is B. So yes, let me show you this diagram for you to become clear. So I will write it also. Don't worry about that. I will write it also. Okay, so I will just write it also. Okay. So let me explain the MCQ. So let's let everyone see the session. So here what you can see, actually in this diagram, this is the base of the skull. In this diagram, this is the base of skull. This is the base of skull which you are seeing. Okay, this part is the base of the skull. Let me slightly enlarge it. Okay. Okay, this is the base of the skull, and here this is the superior constrictor muscle. So this was asked with you. So what structures passes between the base of the skull and superior constrictor muscle? So the structures which is traversing between the base of the skull and superior constrictor muscle is as shown here. That is auditory tube is here, which is shown, and this is the ascending palatine artery. Ascending palatine artery. What is it? Ascending palatine artery is passing. Ascending palatine artery, the auditory tube is there, ascending palatine artery is there. Also levator villi-platini muscle. Okay, levator villi-platini muscle which is shown. So 3 structures has been shown in this diagram. This is a schematic diagram to make you understand. Auditory tube, ascending palatine artery and levator villi-platini. Also one more artery is there, that is the palatine branch of ascending pharyngeal artery. Now when we see the superior, when we see the space between superior and that of middle constrictor muscle, superior and that of middle constrictor muscle, the structures passing is glossopharyngeal nerve and stylopharyngeus muscle. The structures passing is glossopharyngeal nerve and stylopharyngeus muscle. Okay, below the middle constrictor, so in the space between middle constrictor muscle and that of inferior constrictor muscle, the structures traversing is internal laryngeal nerve and superior laryngeal vessel. Superior laryngeal vessel. These structures are going internal laryngeal nerve and superior laryngeal vessel, and in between inferior constrictor muscle. Actually, in inferior constrictor muscle, it has got 2 parts, that is cricopharyngeus and thyropharyngeus, and in between these 2 structures, the structures traversing is internal laryngeal vessel and recurrent laryngeal nerve. Internal laryngeal vessels and recurrent laryngeal nerve. Okay. So all these structures has been shown in this diagram. This is a very useful schematic diagram explaining you the structures passing in between the constrictor muscle. So I would like to give you the detail also. I would like to give you the details also. So please note down, everyone, please note down this. This will be useful for you. So write down the heading and please note down. The heading is structures passing above. So above SC, what is SC? Superior constrictor muscle. So structures passing above superior constrictor muscle. The structures are, write down, the following 4 structures passes. The structures are levator villi-platini muscle, palatine branch of ascending pharyngeal artery, also ascending palatine artery, and the 4th structure is auditory tube. So 4 structures are passing. So please write down the name of all the 4 structures. The 4 structures which is passing above the level of superior constrictor muscle. So exact location is between superior constrictor muscle and base of the skull. So the exact, if you want to know the exact location, it is between the superior constrictor muscle and the base of the skull. And the structures traversing is levator villi-platini, palatine branch of ascending palatine artery, ascending pharyngeal artery, ascending palatine artery and auditory tube. Now we will see the structures passing in between. Write on structures passing between SC and MC. What is this? Superior constrictor and that of middle constrictor. The structures passing in between superior and that of middle constrictor. The structures are ninth cranial nerve and the muscle which is getting innervation from ninth cranial nerve. So that is stylopharyngeus muscle. That is stylopharyngeus muscle. Stylopharyngeus muscle. So yes, we have done this. This was the second gap. So first and second gap has been done. Now moving on to the third gap. So the third gap is between the structures passing between the gap between middle constrictor muscle and inferior constrictor muscle. The gap between middle and inferior constrictor muscle. So the structures passing are 2 structures passes, internal laryngeal nerve and that of superior laryngeal vessel. So superior laryngeal artery, So fourth gap, that is the gap below, gap in between inferior constrictor muscle. Actually, inferior constrictor muscle is having two parts, thyropharynges and cricopharynges. So, the gap between thyropharynges and crico, actually this space is also called as tracheoesophageal groove. This space is also called as tracheoesophageal groove. And the structures passing through tracheoesophageal groove are following structures passes. The structures are inferior laryngeal artery, and recurrent laryngeal nerve. Recurrent laryngeal nerve. Done? So, I think this is clear to you now. So, in short, we have completed the topic of gap lying between the constrictor muscle and the structures traversing between the constrictor muscle. Okay, the structure which is passing through or in between the constrictor muscles. Got it? So, let us move on to the second MCQ, everyone. So, let us move on to the second MCQ now. So, moving on to the second MCQ. Okay, this was the second one. I think this is the second one. So, yes, all transmit arterial branch to meninges except, all of the following is openings which is written here, that is foramen ovale, foramen rotundum, jugular foramen and mastoid foramen. So, all foramen is transmitting arterial branch to meninges except. So, your time starts now. Mark the correct answer. 4 options are there: A, foramen ovale, B, foramen rotundum, C, jugular foramen, D, mastoid foramen. So, yes, I got 360 is telling C, jugular foramen. Okay. 360 is telling it's C. So, what about others? What about others? Don't worry, I will come up with explanation also. So, yes, Shahrukh Ahmed is telling D, mastoid foramen. Mixed bundle of answers are coming. Again, mixed bundles of answers are coming. So, yes, Sam is telling it's C. Yeah, the MCQ is second one. So, please, this is the second MCQ. This is the second MCQ. This is the second MCQ. Kumaran is telling D. So, D, C, D, C. So, D, C is coming up as the answer. Please mark the MCQ question, arterial branch to the meninges, arterial branch to the meninges. So, I will wait. Shweta is telling D, then I will come up with the explanation. So, can I start explaining this MCQ? Actually, the correct answer here is B, foramen rotundum. B is the correct answer. No, don't worry, I will explain it. The hint was arterial branch. So, you have to trace out the location and you have to know which structures is passing, and then we will come up with the explanation. So, one by one I will come up with the explanation of structures passing through each of this foramen. So, let us start with this. Actually, when we talk about foramen ovale, the structures passing is male. The structure passing through foramen ovale is male. The structures passing through foramen rotundum is male for mandibular nerve, accessory meningeal artery. Okay, meningeal artery means arterial supply to meninges is passing, no doubt. Lesser petrosal nerve and emissary vein. When I tell ME, it means the structures passing through foramen rotundum is, what is it? It's maxillary nerve and emissary vein, no artery. When I talk about jugular foramen, many structures are passing. Actually, many structures. Actually, it is having 3 compartments and it is also giving branch to meninges. Okay, a meningeal branch is given from the occipital or ascending pharyngeal artery. Yes, when I talk about mastoid foramen, it is also giving a branch to meninges. So, it is also giving branch to meninges. Only foramen rotundum is not giving branch to meninges. So, let me come up with the structures passing through each foramen. Okay. So, firstly, 4 foramens was mentioned in the MCQ. So, you have to know about this 4 foramens was mentioned there. Okay. So I would like to firstly tell you about the location, okay, about the location which is seen. This is a diagram in which you can identify the location. So firstly I would like to tell you about the location. So yes, when I am talking, so how many? Foramen ovale, foramen rotundum, jugular foramen, mastoid. So in this diagram you can see the foramen ovale and foramen rotundum, okay. So this is the interior of the cranial fossa. So let me just highlight it more, okay. Yeah. Now the foramen which was asked, this is ovale foramen which you are seeing, this is foramen ovale, okay. This is foramen ovale. Nervus spinosum, okay, foramen rotundum, nervus spinosum, okay. What he is telling for, so we are talking about so arterial supply was asked, okay dear, arterial supply to the meninges was asked, okay, not the nerve supply, okay. 360 degree, you are slightly confused, okay. That is foramen spinosum and we are talking about arterial supply, nervus spinosum and foramen spinosum. So you are slightly confused. 360, Acharya has given you the right answer, that is nervus spinosum is passing from foramen spinosum. So okay, so yes, this so two foramen, one is foramen rotundum, okay. This is the foramen rotundum which you are seeing and this is the foramen ovale. Through foramen rotundum the structure passing is ME, that is maxillary nerve and emissary vein, and through foramen ovale the structure passing is male, okay. The structure passing is male. So I will just stick to the options which was given in this MCQ. So male means M for mandibular nerve, A for accessory meningeal artery, accessory meningeal artery. So yes, means meningeal artery is given. So this is not the right answer. This is giving arterial supply to meninges. L means lesser petrosal nerve and E means emissary vein. When I am talking about foramen rotundum, it is not giving any arterial supply. It is giving maxillary nerve and emissary vein. So that is the reason foramen rotundum is the correct answer. So please write down if you are confused. So don't worry, you can write this. Okay. So write on the heading, structure passing through foramen ovale. These foramens are lying in the middle cranial fossa. The structures are 4, and how you can study the name? By a mnemonic, that is male, M-A-L-E. So through foramen ovale the structures passing is male. M for mandibular nerve, A for accessory meningeal artery, accessory meningeal artery. L for lesser petrosal nerve, L for lesser petrosal nerve, and E for emissary vein, E for emissary vein. So is it clear to you now? Now it is definitely clear that accessory meningeal artery is passing. That means yes, meningeal artery is passing through it. Okay, so this can't be the correct answer because the question was asking meningeal artery, a branch to meninges is not given. So foramen ovale can't be the answer. Okay, the emissary vein which is passing here is forming a communication with the cavernous sinus and pterygoid venous plexus. So this was the first option, this was the option, okay, and now moving with the other option. One other option was foramen rotundum. So foramen rotundum, the structures passing through foramen rotundum is maxillary nerve and emissary vein. So you can just remember it with a mnemonic ME, me, and this is male. Through ovale, male, and through foramen rotundum, me. Okay, now moving on to the next. So let me slightly enlarge it. Okay, so now the other foramen, can you see the green color probe is introduced in the skull? So this probe which you are seeing, let me just highlight this. Can you see this probe? So this probe is introduced in which foramen? This probe is can anybody tell me this answer? This probe is introduced in which foramen? Okay, 360, Acharya, please try. Kumaran, Shweta, Sam, Virat, Saruk, this foramen. So green color probe is introduced in which foramen? This is which foramen, everyone? This is jugular foramen. Yes, absolutely right. So Acharya has given the right answer. It is jugular foramen. Absolutely right. So jugular foramen is also not the right answer because it also traverses meningeal branches. So let me just tell you the structures passing through jugular foramen. Okay. So write on jugular foramen. Everyone right. Kumaran right. Yes. Jugular foramen. Okay. So yes, jugular foramen. So we should know the structures passing through jugular foramen. So write on the heading jugular foramen. So actually when we talk about jugular foramen, it can be categorized into 3 compartments. It can be categorized into 3 compartments: anterior, intermediate and that of posterior. Okay. So compartment, actually many of you have given this answer, because it is important that you should know more detail about this, because it's required to know each compartment structures passing. So through anterior compartment. So through anterior compartment, if I talk about anterior compartment of jugular foramen, the structures passing is inferior petrosal sinus. The structure passing is inferior petrosal sinus. Yes. If we talk about the intermediate compartment, so the second is intermediate compartment. So if we talk about intermediate compartment, the structures passing is 9th, 10th and 11th cranial nerve. Now moving on to the posterior compartment. Structures passing through posterior compartment. Structures passing through posterior compartment is sigmoid sinus, which will pass through it and will continue as internal jugular vein. It will continue as internal jugular vein. What else? It all through this. So here comes the answer. Through it also passes meningeal branch of occipital, and ascending pharyngeal artery, Through it passes meningeal branch of occipital and ascending pharyngeal artery. So my dear friends, again we got the meningeal branch passing from jugular foramen. Got my point? So now are you right? Okay. Yes, 9, 10th and 11th, 360 degree, absolutely right. So yes, posterior, when I am talking about the posterior aspect of jugular foramen, the structures traversing is meningeal branch of occipital and ascending pharyngeal artery. So again it is giving meningeal branch, so it can't be the correct answer. So now one more foramen was there. What was it? Mastoid foramen. So everyone, can you see the location of mastoid foramen? I have shown it with yellow color. So I have just shown it with yellow color. This foramen, this small foramen which you are seeing here, this small foramen is mastoid foramen. This small foramen is mastoid foramen. Everyone, this is lying in the mastoid process of the temporal bone. Which bone is this? This second number is which bone? Second number is temporal bone. Which bone? Second number is temporal bone. This is temporal bone. This is temporal bone. This is parietal bone. This is the occipital bone. And here in the mastoid part, here in close to the mastoid part of the temporal bone, the foramen which is seen is the mastoid foramen. So some of you have also given the answer as the mastoid foramen. It can't be the correct answer. The reason is that through it passes meningeal branch. Actually, through it also passes meningeal branch to dura mater. So structures passing through mastoid foramen. Can anybody give me the answer? Structures passing through mastoid foramen. So let me write it, don't worry, write on the heading. Structure passing through mastoid foramen. So yes, who has given this answer? Mastoid emissary deoxydabin is absolutely right. Deoxydabin has absolutely given the right answer. Deoxy, you have given the right answer. And the structures traversing through mastoid foramen is following. The structures are mastoid emissary. The structures are mastoid emissary vein. This mastoid emissary vein is given to sigmoid sinus. It is given to sigmoid sinus. Yes, meningeal artery also, absolutely right, deoxydabin, you have given absolutely right, okay. And it also give a posterior meningeal artery, it also give posterior meningeal artery to dura mater. Okay, so yes. So yes, sigmoid sinus and posterior meningeal artery, actually it also gives a branch to say small branch from the occipital artery also, it's traversing through, that is posterior meningeal artery, a branch from occipital artery. So I think this is enough for the explanation. Have everyone understood? Okay, have you understood? So if you have, so now you are knowing why the answer B was right. Foramen rotundum was why right? Because through foramen rotundum only none of meningeal artery was passing. Branch to meninges was not passing. Arterial branch. The MCQ is about arterial branch. So everyone have understood? Can we move to the third MCQ? Okay, so if you have understood, please give me a thumbs up. Then we can move to the third MCQ. Yes, Saruk, thank you. So let's move on to the third MCQ now. Okay. So yes, third MCQ. Which fascicle layer is not correctly matched with the structure it includes? So this is a match the following kind of MCQ. So yes. So you have to tell me which fascicle layer is not correctly matched, whether it is A, superior cervical fascia is enclosing platysma. Thank you Deoxy Kumaran 360 Sarukama, thank you. So which fascicle layer is not correctly matched with the structure it encloses? Option A, superior cervical fascia enclosing platysma. Investing layer of deep cervical fascia enclosing trapezius sternocleidomastoid muscle. Option C, pretracheal layer of deep cervical fascia enclosing suprahyoid muscle. Option D, prevertebral layer of deep cervical fascia enclosing longus colli, longus capitis, scalenus, deep cervical muscle. Thank you Shweta. So give me the correct answer. Question number 3. So I got Sam is telling it's C, Gopika Sarma is telling C. Gopika Sarma is also telling it's C. So what about others? What about others? So I will I will wait for you and then I will come up with the explanation. Kumaran is telling its 3, answer is C. Okay. Deoxy is also telling C and 360 degree is also telling C. So my dear friends, all of you are perfectly correct and the option C is perfectly correct. So the correct answer is 3. Actually, pretracheal layer of deep cervical fascia including suprahyoid muscle. Is it correct? It is including which group of muscle? Is it supra or infrahyoid? Is it supra or infrahyoid? That is infrahyoid group of muscle. That is infrahyoid group of muscle. Okay. Now let me explain all the option. What was the first option? Superficial fascia including platysma. So yeah. So let me just highlight this diagram. So this in this diagram I am showing you the platysma muscle. So here you can see this is the whole outline of the platysma muscle which is shown here. Okay. This is the platysma muscle. Yes, absolutely right, Sam. So platysma muscle. So this is platysma muscle, and platysma muscle is lying in superficial fascia. Actually, superficial fascia is wrapping the platysma muscle. Okay, actually superficial cervical fascia is wrapping, you can say wrapping or containing subcutaneous tissues, and this subcutaneous tissue is containing a muscle. What is it called as? It is called as platysma. Can anybody tell me the muscles which lies in superficial fascia is given a definite term? So can you tell me what is that definite term used? The muscle which is residing or lying in superficial fascia, generally muscle lies in is covered by deep fascia, but few muscles in our body is covered by superficial fascia. So that muscles are called as which group of muscle? Can anybody try? Just give it a try. That group of muscle is called as which muscle? Anyone? That group of muscle is called as? Just give it a try. That is called as panniculus carnosus. That group of muscle, the muscle which is wrapped or lying in the superficial fascia, that muscle are called as panniculus carnosus. So platysma is an example of which group of muscle? Panniculus. Absolutely right, deoxy. Panniculus carnosus. Absolutely right, carnosus. So it is a panniculus carnosus muscle. Other example of panniculus carnosus muscles are muscles of facial expressions. I am using my muscles zygomaticus major, minor, orbicularis oculi, ori, levator anguli, superioris, levator anguli, alechnasi, depressor anguli oris. So all these muscle group of muscles, rhizorius, mentalis, all the muscles which is residing in the face is an example of panniculus carnosus. Absolutely right, deoxy. And other example is the muscle which is lying in the anal margin, that is cutis ani. Dartos muscle of the scrotum is also example of panniculus carnosus. So these are certain things of general anatomy. These are the sessions. So those who want to, yeah, absolutely right, deoxy, absolutely right. Yes, palmaris brevis is the muscle which is lying in the hypothenar area close to this medial aspect. Here is the small muscle which is also example of panniculus carnosus. So anybody wants to revise general anatomy session, they can again see my special sessions on the Unacademy special class by unlocking the code, and NAT 10 is my code. You can unlock it and see the free sessions of mine on the special Unacademy platform. Don't worry, you can revise it. So yes, so we have done with this. And the platysma, if we talk about the platysma muscle in more detail, if you just want to know the platysma muscle, the platysma muscle overlap overlaps SCM. What is SCM? It is overlapping sternocleidomastoid muscle. It is overlapping sternocleidomastoid muscle. The platysma muscle is overlapping sternocleidomastoid muscle. Okay, it's overlapping sternocleidomastoid muscle. Got it? Now moving on to the next. So we will have the next set of discussion of the other options also. So yes. Okay. So we have done with the platysma group of muscle. Now moving on to the next one. So yes. Yeah, deoxy Dartos muscle is absolutely right. Dartos muscle is absolutely right. Okay. So if you will see the continuity in this diagram, also not shown here, but actually platysma muscle is over, it is running over pectoralis major and deltoid muscle and then going towards the neck region, then it is traversing through the neck region. It is having a continuation which is coming from pectoralis major and deltoid muscle and then going into the neck region, and it merges with the muscles of face along the angle of mouth. Okay, along the angle of mouth. Now, so yes. So now moving on to the other options. So here in this diagram I want to show you here. So let me use different color for the muscles. Okay. So I am using red color for investing layer. So you can see here, this is the investing layer. So this outermost, actually deep cervical fascia, so let me slightly enlarge it. Okay. So actually deep cervical fascia, when we talk about deep cervical fascia, it is having 3 layers. It is having 3 layers. It is having 3 layers. One is the one layer is called as the investing layer of deep cervical fascia, the other is called as pretracheal and the other is prevertebral. So I am using red color for the investing layer. See here, this whole layer which I am using here. Okay. So I am using red color for this investing layer, and you can see here investing layer. Now you can see investing layer is clearly as shown in the diagram. Investing layer, as you can see here clearly, investing layer is enclosing sternocleidomastoid muscle anteriorly and posteriorly. Which muscle? Trapezius muscle. So yes. Now moving on with the next. I am using green color. I will use pink color for that of pretracheal layer. When you see the pretracheal layer, you can see pretracheal layer here is enclosing the gland, thyroid gland, and also forming anterior layer of carotid sheath, and it is lying in close relation with infrahyoid muscles, sternohyoid, sternothyroid and omohyoid muscle, as you can see. Okay. When we are seeing the prevertebral layer, I am using black color for the prevertebral layer. It is going posteriorly, covering the muscles. Prevertebral layer is covering the muscles back, and this is the prevertebral layer which is covering ascalenus group of muscles and all splenus capitis and all. So this is absolutely, these all options which was given was absolutely correct. So here we can see the pretracheal layer is enclosing infrahyoid muscle and not the suprahyoid muscle. So see here, these are the list of infrahyoid muscle. Okay, the infrahyoid muscles are thyrohyoid, sternothyrohyoid, superior inferior valley of omohyoid and sternohyoid. Okay. So yes, most of you were right. Okay, deoxydabin, yes. So can we move on to the next MCQ, that is MCQ number 4, all of you? Okay, so let's move on to the other MCQ, that is MCQ number 4. Question number 4. Yeah. So mark the correct answer. Where does nasolacrimal duct communicates with the nasal cavity? Easy one. Where does the nasolacrimal duct communicate with the nasal cavity? Whether it is A, superior meatus, B, middle meatus, C, inferior meatus, D, nasopharynx, and E, sphenoidal sinus. So yes, Acharya is telling it's C. Okay, Acharya is telling C. Kumaran is telling it's C. Okay. Kumaran is also telling it's C. Okay, so yes, I got 4C as the answer, inferior meatus. Yeah. Deoxydabin, inferior meatus. 360 degrees telling C, inferior meatus. Okay. Shahrukh Ahmed is seeing C, inferior meatus. So most of the students are telling it's inferior meatus. The correct answer is also C, inferior meatus. So yes, the correct answer is actually inferior meatus, and C is absolutely correct. Nasolacrimal duct. It's a question of direct question of anatomy and also from ENT. So yes, the nasolacrimal duct opening is in the inferior meatus. So quickly I will show you a diagram in which you will have an idea where this structures are opening. So see here. So yes, in this diagram you can nicely see that in the inferior meatus is lying below the inferior turbinate, and the opening which is shown here is the nasolacrimal duct. Okay, when we see the middle meatus, there is a structure which is called as bulla ethmoidalis. Okay, so on bulla ethmoidalis, middle ethmoidal sinus opens, and in the hiatus semilunar, just below the bulla. So just below the bulla, you can see here this area which I am highlighting with yellow color. This is the area which is the hiatus semilunaris, and in the hiatus semilunaris, the structures opening is maxillary sinus, anterior ethmoidal sinus, and frontal sinus from anterior to posterior. The area of the superior meatus is having posterior ethmoidal air sinus opening, and the structure opening in sphenoethmoidal recessus is sphenoidal air sinus. So this single diagram is telling you and showing you all the structures opening in the different meatus of the lateral wall of the nasal cavity. So if you can enlarge and have a view of this. So yes, see here. All these structures has been shown, as you can see here, structures opening in all the meatus. So all of you were correct, and this diagram is enough for the explanation. So let's move on to the next MCQ, MCQ number 5th. Okay. Okay. So yes, question number 5th MCQ. Which of the following is not a branch of first part of maxillary artery? Which of the following is not a branch of first part of maxillary artery? Whether it is A, deep auricular, whether it is B, anterior tympanic, middle meningeal and accessory meningeal artery, inferior alveolar, or descending palatine artery. So mark your answer. 5 options are there. Question number 5th. Which of the following is not a branch of first part of maxillary artery? So yes, waiting for the answers. Yes, so we have got Hari's VP is telling E, Sam is telling E, Acharya is telling C. Okay, waiting for others to answer. (360° also telling C. Okay, means the branches of maxillary arteries should be revised. That means branches of maxillary arteries. So deoxydavin is giving the explanation also, and he has given the right explanation. It's a branch of third part of maxillary artery. Yes, very good, Deoxy. Yes, Kumaran has given E. So most of you have given right answer. Few confusions are there. So I will explain the branches of maxillary artery. The correct answer here is E. E is the correct answer, that is descending palatine artery. E is absolutely correct answer here. So yes, let's come with the explanation of the MCQ. So I will write down the branches of each part of maxillary artery. Before that, I just want to show you this diagram. Here you can see actually maxillary artery is a branch. It's a terminal branch of which artery? It's a terminal branch of external carotid artery. Maxillary artery is a branch of external carotid artery. So branches from the first part. The branches from the first part is middle meningeal artery, deep auricular artery, anterior tympanic artery, inferior alveolar artery, and accessory middle meningeal artery. So all these 5 branches are the branches from the first part. All these 5 branches are the branches from the first part of maxillary artery. Now, when we see the branches from the second part branches are actually muscular. All the branches from the second part is muscular, that is masseteric artery, okay, masseteric artery. Other than that, we have got buccal artery, we have got the branches that is deep temporal, and we have got pterygoid branches, okay. All the branches are muscular, and the rest all branches which is shown here, the branches from the third part, pharyngeal artery, artery to pterygoid canal, sphenopalatine artery, infraorbital arteries, and that of palatine arteries, okay. So, now I will give you also how to memorize these branches. I will give you the mnemonic, and because many branches are there from the three parts of maxillary artery, okay. So, it is a terminal branch of external carotid artery divided into first, second, third part in relation to lateral pterygoid muscle, okay. The third part is traversing through the pterygomaxillary fissure, and the branches are going deep to pterygomaxillary fissure. The second part branches are muscular, and the first part branches are 5 important branches. So, let me first describe branches of maxillary artery. So, please write on the heading, branches of maxillary artery. Branches of maxillary artery, okay, branches of maxillary artery. So, yes, so now first part. So, firstly I would like to tell you the branches from the first part of maxillary artery. So, first part of maxillary artery is giving the following branches: middle meningeal artery, accessory meningeal artery, accessory middle meningeal artery, anterior tympanic artery, deep auricular artery, and inferior alveolar artery, inferior alveolar artery. Okay, all these branches which I have written are the branches from the first part. So, how you are going to memorize these branches, this 5 names? So, there are mnemonics, there like Damia is the mnemonic. So, either you can go for the mnemonic Damia, or you can go for mnemonic Ma, Di, Ma and Di, okay. So, both mnemonic is there, whichever suits you. One is Damia, D for deep auricular, A for accessory middle meningeal, M for middle meningeal artery, I for inferior alveolar, A for accessory middle meningeal artery, okay. Anterior tympanic and accessory middle meningeal artery, both A, and Ma, M for middle meningeal, A for accessory middle meningeal, and A for anterior tympanic, D for deep auricular, I for inferior alveolar. So, this is the mnemonic for the branches from which part? First part. Now, moving with the branches of the second part of maxillary artery. So, very easy to memorize the branches of second part of maxillary artery. So, branches of second part of maxillary artery, branches from the branches of second part of maxillary artery. So, the branches from the second part of maxillary artery is all the branches are muscular. So, how we are going to remember all the branches of second part is muscular. Okay, so Kumaran is giving another mnemonic I am da, okay, yes, any of the mnemonic, Admi, okay, Admi, yeah, any of the mnemonic which is, so Sam Kumaran has given very good mnemonic, so very good. So, whichever suits you, you can revise. Muscular branches, so no need for any mnemonic, it is the muscular branches. So, the branches are masseteric branches to the masseter artery, buccal branches to that of buccinator artery, pterygoid branches to pterygoid muscles, pterygoid branch, and deep temporal. So, actually deep temporal to the temporalis muscle, deep temporal to temporalis muscle, deep temporal arteries. So deep temporal arteries are actually two in number, anterior and posterior deep temporal arteries. Now coming to the branches from the third part. Branches from the third part of maxillary artery. Third part of maxillary artery branches. The branches are descending palatine artery. Actually, descending palatine again divides into greater and lesser palatine arteries. The second branch, infraorbital artery. The infraorbital artery is again giving another branches. So when we talk about infraorbital artery, it is giving anterior and that of middle superior alveolar artery. Okay, everyone? Okay, yeah. The third branch, sphenopalatine. Actually, sphenopalatine artery is also the terminal artery, and it is also called as nasopalatine artery. The other name is nasopalatine artery. This is the terminal branch of maxillary artery. Other is artery to pterygoid canal. Artery to pterygoid canal. Posterior superior alveolar artery. Posterior superior alveolar artery. And that of pharyngeal artery. Pharyngeal artery. So all these are the branches. So we have got altogether how many? We have got 6 branches. So we have got altogether 6 branches from that of third part of maxillary artery. So for the mnemonic, I can say most of the branches here. So I will just most of the branches is having P, palatine, sphenopalatine. Okay. Palatine, sphenopalatine, that is also having P. Artery to pterygoid canal, P. Posterior superior alveolar is having P in it. Pharyngeal artery is having P in it, and infraorbital is only not having P in it. That is again giving branch anterior, middle, superior. Most of the branches of third part is having P word in it. Okay. So got it? So it is now clear to everyone that infraorbital, I think the option which was given here, descending palatine artery is a branch from third part. Descending palatine artery is a branch from third part. Now moving on to the 6th MCQ. So let's move on to the 6th MCQ for today's session. Okay. So, I would like to read the MCQ for you. All of you just attempt it. 23-year-old female is brought to emergency department unconscious after a motor vehicle accident. A linear skull fracture is occurring in the area of junction. The junction of frontal, parietal, temporal and sphenoid bone seen on the X-ray. A branch of which of the following artery is most likely to be severed in this patient? Pig pass. Okay, pig pass is the mnemonic. Yes, Sam, good mnemonic. Pig pass. So Sam is giving a mnemonic, that is pig pass for the branches of third part of maxillary artery. Okay. So good, we can gain from our friends and colleagues. That is very good point. So good mnemonic, dear. So question number 6, which is the correct answer? So deoxy is coming up with the so you have to give me the answer deoxy exactly. Okay, so deoxy is giving as B as the answer. Let's others also tell me the answer, then I will come up with the explanation. Acharya is telling B, Sam is telling 6B. Middle meningeal artery is damaged. Yes. Question number 6. 6 is D. Middle cerebral artery, Fazal Gore, it's cerebral artery. Okay, let me come up with the explanation. Actually, the correct answer is maxillary artery. The artery severed the linear skull fracture, and the landmark which was given is, the key point is the landmark is given is the junction of frontal, parietal, temporal and sphenoid. So, this junction is called as pterion, and here the branch of maxillary artery, that is middle meningeal artery, which branch? 360 is telling F facial, no dear. So, the branch is the frontal branch from the middle meningeal artery is involved, and middle meningeal artery just now we have seen it's a branch of maxillary artery. So, maxillary artery is the correct answer. Yes, absolutely right deoxy, it will lead to epidural hematoma, absolutely right. So, let me come up with the explanation, the explanations. So, the patient described in the question has been suffered from the fracture at the junction of frontal, parietal, temporal, sphenoid. So, here you can see frontal, parietal, sphenoid and temporal bone. There lies which artery? Middle meningeal artery, frontal trunk is located, and this is the region which is medically, this is having a thin bone, 4 bones are meeting, and it can lead to the bleeding from middle meningeal artery, anterior trunk. So, in this bone I just want to highlight you the location of middle. So, let me just use this. Okay. So, here you can see here. Okay, this rounded structure which I have shown you is the location of pterion, and this is the junction of F for frontal bone, this is the junction of P for parietal bone, T for temporal bone. Okay, junction of parietal, frontal and S for sphenoid bone. Okay, so 4 bones are meeting here. Okay, S sphenoid bone, P parietal bone, T temporal and F frontal bone, and that junction is called as pterion. So, same thing I will show you once again with this diagram. Here pterion is the level and where middle meningeal artery, anterior trunk or frontal trunk is traversing. So, that artery is injured and it will lead to epidural hematoma. The other branch, so we have come up with the right answer. Now moving on with the incorrect option. So, I want to explain you the incorrect options also. So, incorrect option is occipital artery can't be the answer. Why? Because occipital artery is a branch from external carotid artery exactly arising opposite to the level where the facial artery arises, and occipital artery is a branch from external carotid artery which is giving blood supply to the posterior aspect of scalp and that of sternocleidomastoid muscle. Sternocleidomastoid muscle. Now moving with the next, the other artery was ophthalmic artery. My dear friends, ophthalmic artery is a branch of which artery? Internal carotid artery. It's a branch of internal carotid artery, and it is mainly giving blood supply to the orbit and contents, eyelids, forehead, nose and nasal mucosa. Internal carotid artery is not giving any kind of branch in the neck region. So, this can't be the correct answer. The other branch was ophthalmic artery. So, ophthalmic artery, just now we have seen the ophthalmic artery branch of internal carotid artery, and here in this diagram you can see it is giving branch and blood supply to the orbital content. It is giving branch to lacrimal gland, it is giving supraorbital, supratrochlear, all these branch, anterior, posterior, ethmoidal, all these branch, central retinal, lacrimal artery, all these are branches of ophthalmic artery. So, it is not giving any blood supply to the lateral aspect of the skull. Middle cerebral artery. Middle cerebral artery is a branch from internal carotid artery, supplies much of parietal and temporal regions of the bone, and injury to this artery and its branches can cause subarachnoid or intracerebral hemorrhages. So, middle cerebral artery will cause subarachnoid and intracerebral hemorrhages. Here you can see this is the middle cerebral artery stem traversing through lateral sulcus, and it is supplying deeper aspect of the, it is supplying deep structures of the brain, deeper structures like caudate nucleus, internal nucleus, caudate nucleus, putamen, globus pallidus, and also the supralateral aspect of cerebral hemisphere, not giving branch to the lateral part of the skull. Sphenopalatine artery. Sphenopalatine artery is a branch from third part of maxillary artery, and it is giving blood supply to the nasal mucosa. It anastomoses with the branch of ophthalmic facial artery and forms causal back plexus. So, I would like to show you the diagram, and it is an important artery for frequent nasal bleeding that is called as epistaxis. So, this is often involved, and it is an artery of epistaxis, sphenopalatine artery. So, see this diagram. So, here you can see the branches which is giving to the nasal area, and here they are forming arterial anastomosis or causal back, branches from anterior ethmoidal, branches from sphenopalatine artery, palatine artery, and branches from facial artery. Facial artery can't be the answer. Study only one of the MCQ I have targeted about facial artery. It's a branch from external carotid artery, and it traverses over the angle of mandible, then it is giving superior, inferior, labile, nasal, angular arteries. So, study only we have already discussed this. Its branches are angular, nasal, lateral nasal branches, superior, inferior, labile arteries. It gives labile arteries, and facial artery is again a branch of external carotid artery. So, it is also not giving any branch in the lateral aspect of the skull. Yes, Kumaran, that is the littles area. Absolutely right, dear Kumaran. So, let us move on to the next MCQ, that is MCQ number 7. MCQ number 7. Okay. So, yes, serous demolins are present in large number in which of the following glands? Serous demolins are present in large number in which of the following gland, whether it is parotid, submandibular, sublingual, or pituitary. So, mark the correct answer. Actually, two options are there, that is confusing to you, but you have to select one. You have to select one. Which is the correct answer? Serous demolins are present in large number in which of the following gland? Seven A, parotid. Serous demolins, dear. Sam is telling it's A. Okay. Sam is telling it's A. What about others? So, exhausted, students are exhausted now. Fazal Gaur is also telling it's A. Okay, Fazal Gaur is also telling it's A. What about others? Okay. Kumaran 7A. Okay. So, I would like to explain this MCQ. Actually, the correct answer is B, submandibular. Actually, serous demolins is mainly present in, submandibular gland and that of sublingual. It is present in submandibular and that of sublingual. So, if we have to choose one, both B and C is correct. Both B and C is correct. But if we want to know more number, then I will go with B, submandibular gland. Okay. So, actually, let me show you this diagrams of serous demolins. So, this is electron microscopic view of serous demolins. Actually, see here, this is a mucus acini. These are all mucus acini. Why it is mucus? Because nucleus is towards the periphery. This is the nucleus which is lying towards the periphery. So, this is mucus acini, and mucus acinus is wearing a cap of, this part is of serous acini. So this structure together is called as, it appears like mucus acini is wearing a cap or a hat of serous acini. So here also you can see here, this is serous acini, this is serous acini, this is serous acini. So serous acini is this, and this is mucus. So this is called as serous demulins. This is the reason it is called as serous demulin. What do you mean by the word demulin? That means crescent shape. That is called as crescent shape. It is called as crescent shape, half moon. Okay. So see here, this is the larger view where I want to show you the serous demulin. So this part is serous acini, and this is like a cap over the mucus acini. So actually this shape is a half moon, so this is called a serous. Earlier it was thought that serous demulin is an histological artifact. What do you mean by the word artifact? Means histological slide जब हम prepare करते हैं तो उसके कारण ये appear होता है. Okay, but that is not correct. Actually it is also having a function. Serous demulin is secreting lysozyme, which is having antibacterial property. So see here, more of the serous acini is shown here. This is again, you can see the serous demulin. This is mucus, and mucus wearing a cap is serous, and this is seen in both submandibular gland and both sublingual gland, but more of number in submandibular gland, and it is having lysozyme, and this lysozyme has got antibacterial property. It is having antibacterial property. And also the other point which is important for it is that it is also given a name that is called as guanacine or Hardinge. The other word which is used for serous demulin is, it is called as demulin. Yes, Gopika Sharma, absolutely right. It is called as demulin of guanacine or Hardinge. It is also called as guanacine. Demulin of guanacine, half or crescentic shape. Okay, let's move to the next MCQ. So again today I have taken more time, I think. Sometime I go more detail. Okay, so quickly we will cover up this MCQ. So question number 8, true about parathyroid gland. The true statement about parathyroid gland: A, superior parathyroid gland develops from endoderm of third pharyngeal pouch. B, superior parathyroid gland is constant in position. Is not constant in position. Okay, B is superior parathyroid gland is not constant in position. C is inferior parathyroid, otherwise called as parathyroid 3, and inferior parathyroid is constant in position. Now you have to tell me the right answer. All of you, question number 8, which is the right answer? True statement about parathyroid gland. True statement about parathyroid gland. That's good, man, with super explanation. Thank you 360 degree. Thank you so much. Yeah, because those who knows afterwards they can just quickly means fast forward करके देख सकते हैं. But some of the students who want to know from the basics, so they want more of detail. So that is why I often go in more detailed explanation. So 8 answer is C. Sam is telling it's C. Gopika Sharma is telling it's C. Okay, Gopika Sharma is also telling it's C. So yes, let's come with the explanation of this MCQ. Actually, the correct answer is C. Okay, inferior parathyroid gland is called as parathyroid 3. Absolutely right. So those who have given C is absolutely correct. All other options are not correct. I will tell you why it's not correct. Other options, because Superior parathyroid developed from endoderm of third pharyngeal pouch. Is it correct? Superior is developing from fourth pharyngeal pouch, not from third, but it is developing from fourth pharyngeal pouch. Superior parathyroid gland is not constant in position. It is wrong. It is constant in position. If we compare superior and inferior, the superior is constant in position. Inferior is called as third parathyroid because it develops from third pharyngeal pouch. It develops from third pharyngeal pouch. It developed from third pharyngeal pouch. So yes, C option is absolutely correct. And inferior parathyroid gland is constant in position. It is also wrong. It is also wrong. Why it is wrong? Because it is variable in position. It is variable in position. So yes. So see here, you can see the location of superior. You can see the location of superior. You can see here the 4 parathyroid gland has been shown. So there are 4 parathyroid gland and its position is on the posterior aspect of posterior border or posterior aspect of thyroid gland, as you can see here. So I will just move on to the next MCQ, that is 9th MCQ. Okay, 9th number MCQ. Buccinator muscle is pierced by. Buccinator muscle is pierced by. Buccinator muscle is pierced by. Mark the correct answer. Okay. So yes, Kumaran. Okay. So buccinator muscle is pierced by B. Okay. So yeah. Acharya is telling B, Gopika is telling it's A, Fazal is telling A, Kumaran 9A, 9A. Buccinator I am talking about. Buccinator muscle is pierced by. Kumaran is telling 9A and 360 is rubbed his answer, okay. K. Shweta is telling A. So yes, what is the correct answer? What's the correct answer? So the correct answer is, why I have included this MCQ, because most of you are thinking that buccal branch of facial nerve, but that is not correct. Okay, buccinator muscle is pierced by duct or parotid gland, not Wharton's duct. So the correct answer is C, that is buccal branch of mandibular nerve. So please mark it, the correct answer is C, buccal branch of mandibular nerve. Buccinator muscle is pierced by buccal branch of mandibular nerve. So let me just give you the structures piercing. So please write down the structures piercing buccinator muscle. It's again a direct MCQ. Buccinator muscle is actually pierced by 3 important structures. It is pierced by 3 important structures. What is it? It is pierced by parotid duct. What is the other name of parotid duct? It is also called as Stinson's duct. It is also having or pierced by molar glands of cheek, also by buccal branch of mandibular nerve, also pierced by buccal branch of mandibular nerve. Buccal branch, these are the 3 structures. Okay, so the correct answer will be buccal branch of mandibular nerve. So I would like to show you the diagram also, so that you can get a better idea of this MCQ. Okay, so see here in this diagram, so we can see this is the buccal nerve, and you know that buccal nerve is a branch from mandibular division. So see here, this is mandibular nerve and this is the buccal nerve. You can see here, this is mandibular nerve, and from this only, So let me show you. This is the mandibular nerve, and from mandibular nerve, buccal nerve is traversing and going towards piercing the buccinator muscle. So I think now it is clear by seeing the diagram. Mandibular nerve branch buccal nerve, actually buccal nerve branch from anterior division of mandibular nerve is piercing buccinator muscle. So can we move on to the next MCQ, that is question number 10. Everyone? Great cerebral vein of Galen is formed by, great cerebral vein of Galen is formed by A2 internal cerebral vein, superficial middle cerebral vein and deep middle cerebral vein, anterior cerebral vein, internal cerebral vein and straight sinus. So which is the most correct? Which is the most correct? Great cerebral vein of Galen is formed by, yes, mark your correct answer, then I will explain this. This is a direct MCQ only, I will show you a diagram. Okay, so mark the correct answer A, B, C, D, which is the right answer, question number 10. Today's session last MCQ. So I will quickly cover up because from 9 p.m. I have to start with the FMGE session on the Unacademy special sessions, Unacademy platform. So yes, mark your answer all of you. Great cerebral vein formed by. So Acharya is telling the answer is A. Okay, Acharya is telling the answer is A. What about others? So only Acharya has given the answer, rest of you. K Shweta A. Okay, K Shweta is also telling A. Okay. 360 degree is telling B. Okay. It's a direct MCQ. Vijay Lakshmi is telling B. Okay, Vijay Lakshmi B, K Shweta Acharya A. Which is the correct one? So yes, the correct answer is A, 2 cerebral internal cerebral vein. A is the correct answer. 2 internal cerebral vein is the correct answer. Okay. So great cerebral vein is actually formed by, great cerebral vein is actually formed by the joining of basal vein, that is also called as vein of Rosenthal. The other name of basal vein is Rosenthal vein. This unites with the internal cerebral vein to form great cerebral vein of Galen, Okay. So let me show you the diagram then. So yes, so all of you here, just see here the diagram. So you can see here, this is the internal cerebral vein, and you can see the two side internal cerebral vein is joined by the basal vein. This is the 2 internal cerebral vein, it is also getting basal vein, and you can see here this is the basal vein of Rosenthal, which is also joining it with the internal cerebral vein. Ultimately it is leading to the formation of, great cerebral vein of Galen. Ultimately it is leading to the formation of great cerebral vein of Galen. 2 internal cerebral vein, basal vein uniting and forming great cerebral vein of Galen. Okay, so with this 10 MCQs are finished. All the best. We will meet tomorrow 7:30 p.m. So before ending the session, just a quick recapitulation of the free sessions on the Unacademy platform which I am taking. So you can use my referral code ANAT10 and you can tell your friends, colleague to, and for the updates of my session you can follow me on the Unacademy app. So start following me on the Unacademy app so that you can get update about my free sessions, my plus sessions, and you can view my sessions, free sessions by adding on the code ANAT10, or those who want to take the plus subscription of Unacademy, they can also use the code ANAT10. Schedule for the month of May. So 7:30 p.m. time, let's crack NEET PG. Let's crack NEET PG, 7:30 time till 28th of this month. 9 p.m. timing on the special classes is FMGE. Thank you Kumaran, thank you Shweta. Conceptual anatomy 6 p.m. timing. This is very useful for those who want to appear for next and those who are in the first year MBBS students. So you can tell your juniors also. Let's crack NEET PG. Y-tube session detail is there. Today we have covered up the 6th session. Tomorrow will be the 7th session. FMGE session 9 p.m. session details is there. And these are the topics which will be covered up for the MBBS students. All the best. Keep studying. Thank you so much. Thank you. So we will meet tomorrow exactly. Yes, Kumaran, thank you so much. We will meet tomorrow exactly 7:30 p.m. with more of MCQs, 10 MCQs more, and we will quickly solve this MCQ, revise the topic. All the best. Keep studying. Thank you so much. So I have to just start in another 4 minutes my session on the special classes. Thank you so much. Thank you.